All right, Chief. So tell us a little bit about these COVID cards that we rolled out this week.
Well, today, actually yesterday, we rolled out our COVID-19 information cards, and this is for our first responders. As you know, as first responders and in law enforcement, we're on the front lines. We have a high chance of contracting COVID-19 just by the nature of our duties. So sometimes when you get the stresses of the job, and sometimes you might forget to ask the right questions to protect yourself. So we came up with a COVID-19 laminated card as a little reminder card for our officers. As you can see right here, you can carry it in your pocket, your shirt pocket or your pants pocket, and you pull it out, and it says a few simple questions. Do you or anyone you know feel sick? Have traveled outside the United States in the last 30 days? Do you know of anyone that has contracted the coronavirus? Just some simple questions our officers can gauge on how to respond. And if you break it down, 3 simple ways we call this. It's called AOR. Ask questions. Like I just told you, certain questions. Are you feeling sick? Do you have a fever? Are you having trouble breathing? Observe the actions of the person that you're talking to, and then respond the proper way. If you come into contact with somebody that's sick, you don't want to probably maybe get too close to them. You want to observe social distancing practices. You might look at getting PPE, personal protection equipment on. So this card is just a little reminder card, basically a cheat sheet for our officers to carry and respond when they respond to calls with any call, because you don't know who has COVID, who doesn't. Some addresses are flagged if it has been reported that the house is considered somebody in the house has COVID-19. But I think when you have a quick reference card, almost as you would have a Miranda card when we were officers, and we still carry them, so make sure when you're reading somebody Miranda during an investigation, you make sure you have the exact words being said, so, for court proceedings. So this is just another tool in the toolbox to help our officers out. Anything we can do to protect our officers, our police officers, we're going to do. We've issued 400 of these cards out to officers, full-time, part-time, and other employees inside the building. So they have these cards to reference when they're on calls for service. So I'll open up to some questions now.
Was this based off of what the 911 operators have been doing?
Yes. I know they've been doing something Captain Williams came up with the idea, Captain Byron Williams, in the sport division. We had a couple officers that have been to some calls where they found out after the fact that people inside that location had COVID. They weren't notified beforehand. So, sometimes in our duties, especially for responding, we get, sidetracked. We might not ask the right questions because we're so focused on certain things of the call. Now you have a little card you can pull out, slow down when it's a non-priority call, and ask just a simple couple questions that are on the card. And it's going to protect. It's going to give you that safety. It's going to give you that, remind you to keep that 6 feet distancing. Use good techniques to avoid getting contracting this disease. This COVID-19 virus is nasty. You see what it's doing to the world, let alone the United States. And I'm just hoping that we can get a vaccination for this and put this virus behind us and get things back to normal, whatever normal is going to be. But anything I can do to protect my officers that go out there and put their lives on the line every day, I'm going to do whatever it takes to do that. And this card is just another tool in their toolbox to keep them safe. Yeah, all first responders, not just police officers. You're looking at firefighters, EMTs, and what about our essential employees? The people that are working the restaurants, the drive-through restaurants, the takeout restaurants, people that are working, your mailmen. They're very vulnerable when you think about what they have to handle on a daily basis. So it's more than just first responders, your police, fire, and EMT. It goes out to a wider range of people who are considered essential. People working in grocery stores, they're putting their lives on the line to service us so we can get food. So I think it's important that we all practice good social distancing skills as well as being prepared for the unknown, especially in law enforcement. Everything's an unknown.
And this is going to help you, I know it's give you a little bit of peace of mind. It's sort of a layer of protection against, for your guys out there.
Well, it's a quick reminder. I mean, I'm sure in your jobs, you guys are running out. It's stressful at times. You might forget something or forget to say. So, I mean, with us, it could be the difference of life or death. So we want to make sure we have our officers protected because we don't know what we're dealing with out there. And now with COVID-19, it's another nasty thing we got to deal with out here on the streets. And a simple couple cents to make this card and laminate it can save an officer from getting exposed and possibly saving an officer's life. We've lost several law enforcement officers in this country due to COVID-19 here. And it's and I'm not talking officers that were elderly or young. These were officers that were in good shape. Some of the things I've been reading, and you would think there's no way that person's going to catch it. This COVID-19 is a silent bullet. It will kill you, as it's been proven. And you know, one life lost is too much for me. And when you start losing first responders that have no other choice but to go out here and do their job, it kind of hits you a little bit harder. So we got to prevent our protect our first responders and prevent them from getting exposed.
Have any officers in your agency been affected by it?
You know, God, knock on wood, we've had nobody test positive. That's amazing, considering the volume of calls we handle in this city. We're a very busy city, and we're out here all the time interacting with people. But I attest that to, you know, being mentally and physically prepared, knowing what to do as far as keeping social distancing. Some of the plans we've implemented as far as having people respond to the front desk to report non-priority calls, to have them call in the phone and take calls for service over the phone, and canceling calls that we don't need to really respond to. So I think you put that into play, and then practicing good social distancing and having the right equipment, your gloves, your masks, and limiting your exposure. One good thing about, I can speak for law enforcement, is we're germ freaks. Anytime we deal with people constantly making arrests or go to us, we're always washing our hands. We've been using hand sanitizer, gloves, and masks 40, 50 years in law enforcement. So we have that edge, that muscle memory, that ability to react when we come in contact with somebody, to immediately wash our hands and keep our distance. And even keeping our distance as far as officer safety. We're taught not to get right on top of somebody. We're taught to keep our distance. So I think we have a leg up on most people because it's ingrained in our head. It's muscle memory, and that's why I think a lot of our officers have not been exposed.
But there are times you guys have to go into harm's way.
Oh yeah. And then you immediately got to decontaminate after that and do what you got to do. And we have operating procedures, and we've practiced our procedures, and we've run through them again. We've preached on them. We've briefed on them. So, I mean, God forbid, in the event that does happen, we're prepared to handle anything that comes our way.
And you probably have more. Your decontamination protocols are probably are probably more. How can I put this? More thorough than your average person is.
Yeah. And it's been like that before COVID-19. We have in the law enforcement profession, and as well as EMTs and firefighters, we're trained to protect ourselves not only from a personal attack or injury to us, but also from the unseen attack, germs, viruses, nasty stuff that we see when we're dealing with people at their worst sometimes. So we've been doing this for a long time, and we're going to keep on just trying to, you know, anything we can get equipment-wise, and simple as like I said, a few pennies can save a life, and definitely save you from getting exposed.
That AOR acronym, I assume
Yeah.
it's kind of a memory trick as well.
Yeah, because in law enforcement, AOR means area of responsibility. Our officers in patrol are assigned to an AOR, so it's easy to remember. You know, ask questions, observe what's going on, and then respond. You know, keep it simple. Don't make it too hard. Don't overload the senses. Just sensory perception. Just go in there and be safe. Keep distance, and protect yourself at all times.
And I imagine as well the fact that you put it on a card. That's just one less thing for officers to remember.
Yeah, you got it in your pocket. See how easy it is? Doesn't weigh anything. You pull it out when you need it. You got time to respond, and you can react and ask the simple questions to make sure you don't forget and keep things consistent and uniform throughout the organization.
Next one of us gets a question. Okay, we have to go back and get the information. They forget to ask a question, and they get exposed.
Yes, it's dangerous. You know, I'm just praying that this thing goes away, and they find a vaccine for it so it doesn't come back. That's the biggest thing. So,
Anything else, Hollis?
thank you.
All right, thank you.